Thanks for being
live on Facebook. All right. Wow.
Yeah. All right. Let's see. Dr. Yeung is being so patient with us as we have our technical difficulties. Okay, let's see. Are we live here? We are live. Yeah. Awesome. All right. Let's kick this off without delay. Dr. Yeung was very patient with us, so we figured out our technical difficulties.
No problem.
Thank you so much. All right, so we have with us tonight the wonderful Dr. Yeung, Dr. Patrick Yeung, and he's an OBGYN here in the office of St. Louis, but I'll let you describe more what your specialty is and that sort of thing. We're really excited to have you here tonight. So why don't you start off by telling us a little bit about your family and where you're from, that sort of getting to know you stuff that people always ask.
Okay, great. Thank you so much for having me here tonight. It's an honor and a privilege. I hope this is helpful just to share some information, maybe share some stories or an experience. And if everybody walks away with one thing, that to me is a success. So I am first and foremost a husband and father. My better half is Dorothy Yeung, and we have several kids. We have 4 actually, 1 adopted, and then a 5th is on the way. We're actually due, coming up, thank you. You know, and maybe we'll talk about endometriosis and fertility and adhesion prevention, but I always tell patients we're all in this together because we had the same issues. And Dorothy had her, well, we tried from day 1 to get pregnant, and after about a year of trying, she said, maybe I have endometriosis. I said, no way. She had painful periods her whole life, thought it was normal, was told it was normal. And turns out she had bad endo. And then we tried all the usual things for adhesions, and that didn't work. Really, it didn't work until she had adhesion prevention and Gore-Tex for not just the ovaries, but also behind the uterus and between the uterus. And the bowel is really what helped her feel better, but also has led now to recurring fertility. So we are definitely all in this together.
Yeah, you know firsthand what it's like.
Yes, yes, indeed. So I now direct the Center for Endometriosis at SLU Care at St. Louis University in the division of gynecologic surgical subspecialties, it's called. So we focus on surgery, but we also have a restorative fertility clinic that can address both the surgical, but also the non-surgical aspects of trying to help a couple get pregnant together as a couple and without IVF. And that's been tremendous. And we really, on the surgical side of things, we really try to combine the best of optimal excision and adhesion prevention. That has always been my goal. And being an academics, to try to change paradigms by publishing about that and then teaching the next generation. So
yeah, that's great. SLU's the place to do that.
Yeah, it's
nice
great.
Full program there. That's awesome. Can you tell us a little bit about how you got into this field to begin with? Like, did you always want to be an NFP friendly doctor, or was it a journey for you to get to where you are now?
Well, I have always wanted to be a doctor. At first, I kind of wanted to be a family practice doc, or wanted to be able to address anything that came through the door, you know, from the cradle to the grave sort of thing.
Mm-hmm.
But it's hard these days to be good at everything. And being in family practice, I mean, I never did practice, I did the residency and then went straight into OBGYN. But I just felt like the patients I really enjoyed the most were those trying to get pregnant or those who were pregnant. And to be good at that, especially in this country, I felt like I really had to specialize in that. Initially, I was very interested in medical missions, which I did while I was in family practice training, loved it, would go back in a heartbeat. I hope to go back at some point, but really felt like their own doctors could treat their own better than I ever could, that I would never be as socially or culturally integrated than they would be. Mm-hmm. And that I really kind of was planted here in the US and in a first world country, and maybe this is where I should serve. So
it's like the Mother Teresa quote, right? It's another Mother Teresa
right.
quote where she says, "Go home and love your family, and go home and love."
Yeah,
Yeah.
a bit like that. So having been planted here, you know, it's helpful to specialize in something, to be good at it. And I really felt like to be good at fertility or surgery, I really had to focus on it. In a lot of places where there's not somebody who really specializes in endometriosis surgery, it's the cancer doctors who really are the ones who do the surgery, just to make the point that it can be that extent or level of surgery. The problem with cancer doctors doing endometriosis surgery is that they're not very good at preserving fertility. They just start taking out things, and they're not really into adhesion prevention. They just want to treat the cancer, which translates to treat the endo when they do that. So again, I mean, there are some real heroes out there who are doing it all, OB and surgery and everything. But for me, I decided if I was going to be good at endometriosis surgery and to do the research and publish on it, I really had to focus on that. So that's what I've kind of felt called to in academics. And I did 2 residencies and 2 fellowships to get where I'm at, but I love it. And I'll steal a quote from my wife, and what I do, I feel like does have some eternal value. And so I love getting up every day and doing it.
Yeah, I mean, there's such a need for it too. I don't know how many people I know who've struggled with endometriosis at some point, and it's some of the friends I have who don't live in St. Louis are just like, wherever they live in the country, there's nobody who's really treating it in a way that preserves their fertility. So I mean, exactly what you were saying, there's so many doctors that that's not their main concern. They're not, you know, having the holistic view in mind. So it's so needed.
Right.
Yeah, definitely.
Yeah, I mean, there are Facebook groups out there and people who are really focused on cutting out the endo, optimal excision. And I do believe in that. Again, I was fellowship trained in minimally invasive gynecologic surgery. So really being proficient in minimally invasive surgery, which should be less prone to adhesions.
Yeah.
And really focused on trying to cut out the disease. Patients come from all over for optimal excision of endometriosis.
Yeah.
But pairing that with and combining that with the best of adhesion prevention. Some people are very focused on the adhesion prevention part and not necessarily getting out all the endo, even superficial disease.
Yeah.
So we will cut out whatever is suspicious for endo, both early stage or surface disease or subtle disease, as well as the deep disease, and then try to prevent adhesions and really try to do the best of both. So
yeah, which then prevents future surgeries too.
Right.
Yeah, because I've
definitely
been
a challenge, but a blessing. Yeah.
Right. Yeah. I mean, I've known people that have had adhesions after endo surgery and are in like almost more pain than they were with the endometriosis. So, I mean, you're focusing on both of those. Like, that's powerful. That's really great. So, once again, it's like this holistic view, which is what we're all about. All right. You did a great job of, I'm just consulting with my questions here, and you did a great job of answering 1 and 2. So, that's really exciting. Okay, tell me a little bit about what your introduction was to the world of natural family planning. Is it something that you were always aware of? Is that something that you became aware of, you know, during marriage prep or after that? Or just tell me a little bit about how you ended up in this crazy world. Just as before you answer too, I forgot to introduce our series. So this is the first in our series of live events this week here on our Facebook page. We are going to be talking with different experts in their fields throughout the week right here in the Archdiocese of St. Louis to celebrate NFP Awareness Week. And it has to be virtual because we're all trying to be safe and stay at home as much as we can. So Dr. Patrick Yeung is here for those of you just tuning in, and he's sharing with us a little bit about the work that he does and a little bit about his background. And we're just excited to have him here. So now, Dr. Yeung, I'll let you tell me a little bit about how you ended up in this crazy NFP world.
Well, that's a great question. I am born and raised Catholic, so I guess I've always known about the church's teachings against contraception, but it has been a process and a journey to really understand the real reason why contraception is not allowed by the church, or that there's a better way basically to family plan and to treat women's health issues. My own brother at one point said, you know, what is the difference between NFP and contraception, in one hand, you're putting up maybe a physical barrier. In
Right.
the other hand, like with NFP, he saw it as it's just putting up a time barrier.
Mhm.
Both ways you're trying to avoid a pregnancy. What is the difference? So to understand the difference, that it's not just you're really working with God's natural cycles to
Right.
avoid. I learned about Christopher West's wedding planning, wedding plan, wedding marriage kind of analogy, which really made sense to me in terms of the difference between
Wait, I don't think
contraception
I've
and
heard
family
that
planning.
before. Can you explain that? I don't think I've heard this analogy before.
Okay, really quick. So if God is the author of life, okay, and we talk about, in fact, I use this with patients. I don't, especially if they're married, I don't say sex, I say the marital embrace.
Mhm.
If the marital embrace is how a couple speaks to each other, the language they made on their vows, then anytime they engage in the marital embrace, the author of life may come down and bless that with a new life.
Mhm.
So basically, there is a difference between saying we're going to engage in the marital embrace, but because we don't know when the author of life may come, we don't have his schedule, we don't have his calendar
Mhm.
linked to our calendar, we're going to deliberately do something before, during, or after the act of the marital embrace
Mhm.
to actively disinvite the author of life.
Oh, that's an interesting way of putting it.
That would be different. That would be contraception. That would be different than, we know the calendar of the author of life. We know his schedule.
He shared his Google
And
Calendar with you.
he shared it. And so we can engage in the marital embrace knowing that he's out of town, knowing he will not come.
Yeah.
That is a difference
Oh, I love that
between family
analogy.
planning
I've
and
never heard that
contraception.
one.
So that's
Yeah.
a simple way
That's great.
to think about it. So, and then really seeing that it can be practical, the practical benefits. That's really what Humanae Vitae really called for, is not just a deeper understanding of why the church believes that for the good of marriages and families, and I think we're seeing that more and more, that you have to connect love and life.
Right.
You cannot separate them. But then he called upon medical professionals to make it practical. And there are more and more really methods to avoid pregnancy.
Mhm.
But in terms of achieving, that's the flip side. It's a true method of family planning,
Mhm.
and you can use it as a very powerful tool
Yeah.
to have a woman's health record and to achieve pregnancy. So just seeing all of that and how it can be so practical was eye-opening for me, and really got me excited about trying to provide this type of care for patients. I always say good ethics is good medicine.
Yeah.
If what we believe about God's design for marriage and sexuality and family is true, then it should work and work well. It should be true, good, and beautiful. It should
Yeah.
not be suboptimal medicine. It should work and work the best, actually, if
Yeah.
we're actually operating in a way that is in accordance with the way that we're designed.
Right. Yeah.
So I kind of believe that, and I actually do have an underlying kind of hope that, or belief that, if people keep going down the wrong direction and they keep trying to put in water in the gas tank, it's not going to work.
Mhm.
And eventually, I think that's what John Paul II means about the culture of death, is that it's essentially going to be self-destructive.
Yeah. I mean, there was an article that just came out the other day where they were talking about this huge fertility crash that's about to happen because people are not open to life, and they're afraid of having babies, and they're taking contraception and they're not able to conceive. And it's just so sad. And I love so much what you're describing, because I think so many people have this misconception about the church, that the church is just teaching this because, they're just imposing this on us. This is a sin, blah, 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 without seeing what you're saying, that this is what's good. This is part of God's design for us. It's part of human flourishing. And I think it's especially powerful, especially as a woman, to hear this from a doctor. To hear a doctor saying yeah, a woman's flourishing as a human being matters, and we want to preserve that and help that to be as healthy and strong as possible. So that's just fantastic.
Well, and again, back to our own story, you know, my wife used to say, I mean, we dealt with infertility for like almost 5 years, and that was a tough time to go through. And I remember her talking about how she felt passed over.
Yeah.
That's very hard
Mhm.
to feel like that.
Mhm.
So I'm here to tell couples, you know, you're not passed over, that there is a plan,
Mhm.
whatever that may be, for your family or for your marriage. And you know, she ended up having bad stage 4 endo. Again, after about a year of trying, she had painful periods her whole life. Said maybe I have endometriosis. I said no way. I didn't believe it at first. Turns out she had bad endo. And we were told we would never get pregnant but through IVF. And again, having lived through it, to have somebody do very minimal workup and
Mhm.
then say, we don't really know why you're not getting pregnant. You know, it used to be that everybody would get a diagnostic laparoscopy to look for and treat endo when they were infertile,
Right.
because up to 1 in 2, even without pain, can have endometriosis. Up to
Yeah.
80% of patients with pain and infertility will have endometriosis. So everybody, and surgery helps pain and fertility.
Right.
So everybody used to get a diagnostic laparoscopy who were infertile, but now it's considered optional. And then you're put in this category of unexplained,
Mhm.
which is like a third of infertility, they say these days. But if you look hard enough, you will find a problem.
Mhm.
But to be told, we don't really know why you're not getting pregnant, but give us a bunch of money and we'll do IVF and bypass everything, make a baby in a test tube, put it back, that is not satisfactory to a lot of people.
Yeah.
So just on the human level,
Yeah.
there's so many reasons to really try to find the problem and fix it, which is the
Right.
approach of the restorative fertility clinic.
Yeah.
Once I also saw an Instagram post. It was a baby laying there surrounded by a heart made of syringes,
I've seen that one too.
which I think was a really powerful image of what IVF is like. And for a lot of women, they think IVF is the last stop, their last chance, their last hope.
Mhm.
They don't get many good answers, though. It's not a fun process to go through. But if you can really dig deeper and have the patience or the perseverance to really look through or look under what the underlying factors in affecting fertility are, both surgical and non-surgical, and you correct those things,
Mhm.
you get answers for the patient. And again, for
Right.
a patient dealing with infertility, not having the answer, my wife would say, that's half the problem.
Yeah.
And it's oftentimes more than one thing.
Mhm.
When you correct those things, you often feel better. When you treat endo, oftentimes the pain is less. When you correct the hormones, oftentimes they feel better with mood and things like that. It can lead to recurring fertility. It's billable. So we're always billing underlying diagnoses. We never bill infertility, which, if you think about it, is really a symptom
Right.
of
Yeah.
something deeper.
Yeah. Yeah.
And it can lead to recurring fertility. So for so many reasons, trying to stay focused on finding the underlying problem and fixing it, or
Mhm.
problems, really makes sense to a lot of people.
Yeah. I mean, I love what you're saying too, because I know we've had some secondary infertility in our experience too. And I know that that frustrating feeling of like, what am I doing wrong? But also as a woman, if when you're going through infertility, you think, what's wrong with me? And when you look at like the IVF world, the whole focus is just on the end product. Like it doesn't really look at what's going on with the woman. It says you're only successful if you're able to get pregnant through IVF and you get this end product that we want. What you're describing is more this approach where like, hopefully we'll be able to heal your fertility, but first let's heal you and what's going on with you. What are your underlying issues as a woman? It's just, it speaks so powerfully to the dignity of women. And, you know, the gift of fertility is part of this, but what you're describing, you know, it's not just about the end goal of getting pregnant. It's about wanting to make sure that women themselves are healthy. And that's not the goal of IVF at all. So I just think it's a beautiful testimony. I love how you explained that, because it's just, it really is friendly to women. It's actual women's health, you know? So that's just great.
Well, and if I can take off that, I mean, I love what you said there about it's not just about the fertility, it's also about being healthy. I
Yeah.
think there's a direct correlation between feeling better and chances of pregnancy. If a
Mhm.
woman is feeling better, her chance of getting pregnant, I think, goes up significantly.
Yeah.
And again, when you treat the endo, oftentimes the pain is better. When you treat the hormones, oftentimes they feel better. Do you know what nowadays is the #1 treatment for PMS? It's
What is
antidepressants,
really?
which as a woman, I would think, well, that's a little curious, at least.
Yeah.
People don't think, or at least the evidence is not clear in showing that not enough progesterone or suboptimal hormones and treating or supporting those hormones is the cause of or the treatment of PMS.
Yeah.
But if you look at the literature, it's really inconsistent would be the best way to describe it, because they're not measuring the hormones properly timed to the cycle,
Right.
and they're not supporting them properly timed.
Yeah.
So we work with patients who are trying to get pregnant. We have them chart their fertility. And so they're really involved in the process.
Right.
And they're a key player in the process of trying to figure out what the problem is, because they chart their cycles. You can pick up so many abnormalities or suspicion of things just from the charting, and they get empowered with the knowledge of their cycles, and then they can see things get optimized or see things normalized.
Right.
And that, of course, increases their chances. So I think from the woman's standpoint, it really provides some answers. They're a part of the process, and in the process they feel better. And you know, many patients will say, even if I never got pregnant, our pregnancy rates are very good, up to 75 to 80% in 1 to 2 years, which is a great success rate of pregnancy.
Yeah.
When the national average for IVF is 32%.
Yeah. Much lower.
But they just feel better and have answers, and that alone is worth it, they would say. Yeah.
Yeah. No, that's fantastic. And I would imagine too that it also, one of the things we talk about in our office a lot is, you know, we hear a lot about fertility awareness. You want to be aware of the fact that you have a cycle and that sort of thing. I think there's something of that, some of that awareness just in the general population. Women know they get periods, whatever. But what you're describing is more like another term that we've talked about, which is fertility appreciation, and the idea that there's a value to a woman's body just functioning, for her not being in pain, for her body to be able to work the way it was intended to work. And I think that what you're describing, you know, IVF, once again, it's that focus on like, does this woman's body work to make the baby? And if it doesn't make the baby, I mean, just even as a couple, that's a lot of stress and strain. What you're describing seems like it's more open to the husband even being a part of this process and supporting his wife and understanding what she's physically going through a lot better and appreciating what that process is. And I mean, it sounds like it's something that would be healthier even for a couple to have that support of that sort of mindset, the focus on the wife and her health and well-being.
Well, and I have heard that so many times, and that brings to mind a recent story. I mean, it's an ongoing story, but of a couple, just a beautiful couple, a young couple, and they actually wanted to be missionaries, to go and do missionary work. And she had gone to multiple doctors. No one had ever diagnosed endometriosis or even suspicion for endo. She was offered birth control pills. I mean, maybe this is to the extreme, but the marital embrace was so painful that they rarely engaged in the marital embrace over like 8 years of marriage. It was really prohibitive. And that is really not so uncommon.
Right.
And so they weren't even though they're a young couple, and in theory, they would have loved to have a large family. They were not even, like, fertility and pregnancy wasn't even on the radar. They just wanted her to feel better. In fact, they would even say she felt so bad, that they couldn't imagine how she could help raise a child.
Yeah.
When her quality of life was so poor, and she couldn't do, she was an athlete when she was younger, but the pain got worse and she was basically debilitated. She was depressed.
Yeah.
Really not functional for everyday life at all. So, but when she got her endo cut out, and she felt better, she got her life back, which is a term I've heard several times, and she could be athletic again, she could run again. She had a much better quality of life, more energy, less fatigue. They could engage in the marital embrace after multiple different kinds of therapies, and then they're now pregnant.
That's awesome.
But to get to that end road, they had to go through so many other steps. First, to treat the underlying source of the pain, to even think about pregnancy. That can happen. Absolutely.
Yeah. And that story is just so powerful because I think it highlights how the health of the woman does really affect the marriage as a whole. Because I'm sure that for the husband, you know, as much as she felt like she had her life back, he must have felt like he got his wife back, right? Because it's like
Yes.
she went from just barely functioning and him seeing her suffering all the time to thriving. And you know, within marriage, like it's a gift just if your spouse is healthy, and that means so much to you. And so I love stories like that just highlight how this really supports couples as a whole. It's beautiful.
Well, they're such a beautiful couple. Maybe I'll just say it. They were willing to write down their story. I think their story is so powerful. So I finally decided to put up a website, and I have their story on it.
Oh,
The
cool.
website is called nomoendo.com. NOMOENDO.com.
Okay, I'll have to link
It's
to
meant
that.
to be a website where patients can share their stories of healing and blessing, basically.
That's so
And
great.
her story is so powerful. So it's
Yeah,
out
that
there
gives
for
so
people
much
to
hope.
read. And I think people will be able to relate to her story. It's just,
Yeah,
I mean, every story is unique, but on the other hand, her story and many elements of it are more common than we would think or would hope, which is really unfortunate. Yeah.
That's fantastic. I'm going to check in with our team and see if we have any questions. But if not, let's see. Team, if you're listening, send any questions my way. Not, I feel like I got to ask a lot of questions, which has been exciting.
Yes, indeed.
This is so great. I love how you shared with us too, even the story with your family, because I think, you know, it's so easy, I think, when people are going through infertility to feel like they're the only one and nobody understands. And it's powerful to listen to a doctor who's been through it firsthand with his family, and for you to even have that insight of having walked through this with your wife, and the unique insight even into what it feels like to suffer from it from a husband's perspective and watch your wife go through that. It's just such a powerful witness. That's great.
Well, and again, on that point, you know, I really feel like women think, you know, birth control. I mean, how would you function without birth control? You know, to try to do everything you need to do or live the life you want to live, or how would you get pregnant without IVF? And as you said before, I think the Catholic teaching has just seemed like they're limiting and they're trying to hold people down, for no good reason. But just knowing that there's another way, knowing that there's another option, that is truly effective, but also is just so empowering in terms of giving women and couples knowledge about their cycles, finding out the underlying problems, being able to work along with God's design and not against it, and fixing underlying problems along the way and feeling better is so powerful. And I just think a lot of women don't know that there's another way. It was interesting. Once I had a couple come to me and I asked them how they found, I always ask him, how did you find me? And apparently he had Googled, how do Catholics treat infertility?
Really?
Which I thought was really interesting. But
But
Catholics get a bad rap. You know, I really think that people feel like Catholics are just, you know, behind the times, out of touch with people and reality. But I truly believe that there's a revolution happening. I truly believe that if we, again, are practicing in line with God's will and God's design for our sexuality, that it can work and work very well. And we're finding that out and finding out ways to apply that and make it practical and workable. And this is happening. So it's really kind of a great time, very exciting, because there's more and more tools out there to help women and couples.
Definitely. Okay, I've got a few questions for you. Let's see.
Okay.
I can pull this up. Somebody was asking for you to explain, they wanted to know what adhesion prevention is.
So after surgery, things can always stick together. It's like scar tissue, or like if the tubes and ovaries in particular would stick, that would be bad for fertility. Now, endometriosis as a disease in advanced stages can make tubes, ovaries, and bowels stick. But also surgery can, or at least things can re-stick even after cutting out the endo. So I always say, for best results, for both pain and fertility,
Mhm.
you have to find all the endo, cut it all out. That's optimal excision, but then prevent things from sticking or adhesion prevention. And there's different ways that we do that. One way is to use Gore-Tex. We can wrap up different organs in Gore-Tex, is what they make jackets out of. Nothing sticks to it.
Wow.
It is another surgery to remove it, but it's been shown to be quite effective in open surgery. And we're actually trying to publish a paper on that, where for couples who were infertile, it seemed like those who chose Gore-Tex, they had double the fertility for
Wow.
those who did not choose Gore-Tex.
That's
So it does seem to be a very effective way to prevent adhesions and for pregnancy. In fact, if we publish this paper, it'll be the first paper I'm aware of where we looked at pregnancy as the outcome. Amazingly,
Yeah.
whenever adhesion prevention strategies are studied, they look at second look laparoscopy scores or adhesion scores. They count the adhesions at a second surgery.
Mhm.
But adhesion scores are not the outcome that matter to the patient. What matters to the patient is pregnancy.
Yeah.
And it's actually a lot easier to ask a woman, did you get pregnant or not?
Yeah.
And yet somehow we're always looking at second look adhesion scores and not pregnancy. So
That makes so much
hopefully
more
this
sense.
gets published, and
Yeah.
Gore-Tex seems to be at least twice as good for pregnancy.
Yeah. Well, that's fantastic. Okay.
Yeah.
Somebody else was asking, what should a woman do if she suspects she has endo?
So hormonal suppression, which is what is often recommended or offered first line, like birth control pills, or now there's medications that induce birth control pills are kind of like inducing a chemical pregnancy.
Mhm.
Now there's hormones or medications that induce a type of chemical menopause. The
Mhm.
classic one is Lupron. Now there's something called Orilissa.
Mhm.
Orilissa is a new FDA-approved medication for endometriosis-associated pain, but it's not a new kind of drug or new class of drug. It is simply an oral form of Lupron with the same limitations as Lupron, meaning it causes chemical menopause. So it's not a long-term solution. It doesn't help down the road fertility, and it can have sometimes very serious side effects of menopause or mood changes.
Yeah.
But hormonal suppression does not diagnose endometriosis. It does not remove endometriosis. It does not help fertility now or later. It can have side effects, and it can actually make the symptoms worse. So if you have bad symptoms or significant symptoms of pain or pain with periods, and especially if hormones have been tried and failed to help pain, then that would be reason for surgery. So some people have asked me, well, how much to look for endometriosis? How much pain is enough pain? Well, red flags to me would be if during your periods you are curled up in the fetal position,
Mhm.
lying on the floor.
Mhm.
That is not normal. If you're missing school or work during your periods,
Mhm.
that is not normal. If
Mhm.
you have to plan your vacations around your period, that is not normal.
Mhm.
If you're having to take narcotics, or now it's CBD,
Mhm.
just to get through your period, that is not normal. If you go to the ER multiple times because you're in excruciating pain and all they say is you have a ruptured cyst, that is not normal, and they label you as a frequent flyer. Or the big one is you take hormonal suppression for birth control pills and do not feel better. Those are all reasons to take the next step and have surgery to look for endo. But again, you really need somebody who specializes in not just diagnosing the endo, but also treating the endo. It would be ideal to try to have see and treat laparoscopy, where you go really to an experienced specialist who can identify the endo and cut it out at the same time and achieve optimal excision and prevent adhesions. All that ideally is done at the same time.
Yeah. That was really thorough. Thank you. I've got one more question for you.
Sure.
Someone's wondering when your paper will be published. I know that my husband's an academic, so I know that sometimes you don't have a date for that, but I'll addendum to that. Can you tell us once your paper is published so we can pass that along
Yes.
to people?
So I'm going to have some more details. In fact, I'm giving a talk at the upcoming International Institute for Reproductive Restorative Medicine conference this Wednesday.
Great.
I'll be talking about adhesion prevention and restorative surgery.
Awesome.
And I'll give some more details about that paper, but we are just preparing it for submission. So
It's a drawn out process. Like I said, my husband's
hopefully soon.
I know
We have
the
a
process.
draft. We have the drafts. Yeah, but it's gone through several revisions, and hopefully we'll get there.
Awesome. We'll pass it on to us once you do. All right, Dr. Yeung, thank you
sure.
so much for joining us. This was awesome. Tune in everybody tomorrow. Tomorrow we are having Erin Herdler, who works not only as an NFP instructor, but is also working with our Wonder of Eve program, which is designed for teenagers. So everybody tune in tomorrow for that. So thanks so much, Dr. Yeung.
She's
Hang on
great.
for an extra second once I sign us off of Facebook. Oh wait, hold on. They're saying there are a few more questions. If people want to just pop them below, we can always check in with you later because we're kind of running over. So let's do that. Okay, so for the team, if the team's listening, you can pop the questions in below and then we can always check back with you if we need help answering them. But great. All right, so
Sure.
we will see all of you again tomorrow. And thank you so much again, Dr. Yeung.